Hello everyone. So today's presentation is about the topic normal ECG waves. So in this presentation we are going to see the normal ECG waves. So first of all, ECG waves represents the electrical activity of the heart, with the main waves being the P wave, the QRS complex and the T wave, and some ECGs you can notice the U wave too. So first of all, P wave. The P wave is the first positive deflection on the ECG. It represents atrial depolarization, which is the contraction of the atria. Its normal duration is less than 0.12 seconds. We can call it as less than 120 milliseconds or 3 small squares. So the morphology of P wave is it is smooth contour, and it is monophasic in lead 2 and is biphasic in lead B1. So the second one is the Q wave. The Q wave represents the normal left to right depolarization of the interventricular septum. Small septal Q waves are typically seen in the left-sided leads, which is lead 1, AVL, V5 and V6. This is also called the lateral leads. Q waves in different leads. Small Q waves are normal in most leads. Uh, Deeper Q waves may be seen in lead 3 and AVR as a normal variant, and Q waves are not seen in the right sided leads, which is V1, V2 and V3. It is also normal. So the next one is the R wave. The R wave is the first upward deflection after the P wave. The R wave represents early ventricular depolarization, which is the contraction of the ventricular muscles. A gradual increase in amplitude from the chest lead, which is from V1 to V5 or to V6, with the R wave being small in V1 and it gets skipping larger in the later leads. This pattern, known as normal, this is called R wave progression. So it reflects the electrical impulse traveling towards the left ventricle. So the R wave becomes largest around the later leads, which is V4, V5 or then V6 too. The next one is the S wave. The downward deflection after the R wave is the S wave. Its appearance varies depending on the ECG leads. In the chest leads, it starts deep in lead V1 and gets progressively smaller towards lead V6. In limb leads, it is typically a low amplitude wave and is often not present in lead 1, while lead AVR usually shows the most prominent S wave. So the next one is the T wave. The T wave is the positive deflection after each QRS complex. It represents ventricular repolarization, which is the relaxation of the ventricular muscles. Normal T wave characteristics. The T waves are upright in all leads except AVR and lead V1. The amplitude of the T wave is less than 5 mm in limb leads, which is lead 1, 2, and 3, and it is less than 10 mm in precordial leads, which is the chest leads, V1 to V6, and it is 10 mm in males and 8 mm in females. So the next one is the U wave. The U wave is a small deflection which is immediately following the T wave. U wave is usually in the same direction as the T wave. U wave is best seen in lead V2 and V3. Delayed repolarization of Purkinje fibers is causing the U wave. So these U waves are not seen in every ECGs. If the U waves are seen in ECG, it is because of the delayed repolarization, which is the relaxation of the Purkinje fibers. Features of normal U wave. The normal U wave goes in the same direction as the T wave. U wave size is inversely proportional to the heart rate, which means if the heart rate is slowing down, the U wave gets bigger. So U wave generally becomes visible when the heart rate falls below 65 beats per minute. The voltage of the U wave is normally less than 25% of the T wave voltage. Disproportionately larger U waves are abnormal. Maximum normal amplitude of a U wave is 1 or 2 mm. That's all about the normal ECG waves. Thank you.